Hello everyone, I am Dr. Priya. In the previous video, we have discussed that why nausea and vomiting is seen in pregnancy. Now, in this video, I'll tell you the tips and tricks so that we can avoid nausea and vomiting in pregnancy. So, according to FOGSI, which is the Federation of OBS and Gynae Society of India, they used to recommend certain guidelines which a pregnant female should follow in order to avoid nausea and vomiting. So let's begin. They say that 1 month prior to pregnancy, a female should start taking vitamin B1, vitamin B6, B12 along with folic acid. They should also start vitamin supplementations so that it will correct any pre-existing trace elements deficiency. And there should be certain dietary changes, that is, instead of 3 meals a day, they should take 6 to 7 meals in a day. That is, at 1 to 2 hour of interval, they should take feeds. And the feed should be, there is no any spicy food, and the food should be bland. That is, they can take dry snacks like pomegranate, peanuts, bananas, which can be easily digestible. And they should also avoid certain triggering factors like strong perfumes and closed rooms and heats, humidity, smoke, excessive noise, which can trigger nausea and vomiting. If they are feeling nauseating or there's a feeling of vomiting, in that condition, they should move to a place which has more ventilation, that is, to more open areas. And according to FOGSI, they say that the pregnant female, they should take low fat and low carbohydrate meal, but the meal which is rich in protein. But the most important thing is that there should be adequate rest and appropriate sleep, so that in order to avoid nausea and vomiting in the later period of pregnancy also. And they should also include light exercises and light walking in their daily routine. And under the recommendation of their doctor, they can avoid iron tablets also, because it can also trigger nausea and vomiting in certain females. And you can say a desi nuskha which can be followed by these females is ginger tea or ginger biscuits. You can also prefer chamomile tea, cardamom tea also. In certain studies, they have said that certain acupuncture therapies and aromatherapy can be helpful, but it is not recommended by FOGSI guidelines. And in case if your vomiting is not controlled by these methods, then you can immediately consult your doctor, and they can also prescribe you anti-emetic guidance of your doctor. And if in the case of persistent vomiting, if it is not being prevented by these methods, in that condition it may lead to other condition which is called hyperemesis gravidarum, which we will talk about in our other video. And if you are facing such kind of symptoms like persistent vomiting, even after these steps you are not able to get relief from this, then the certain investigations which can be followed by you under the guidance of your doctor again, and it is also under the recommendation of FOGSI, such as you can go for complete blood count, blood urea nitrogen and serum creatinine ratio. You can also go for daily serum electrolytes, because of persistent vomiting there will be loss of sodium and potassium from your body. So by going for the daily serum electrolytes, you can check your if there is any hypernatremia, hyponatremia or hypokalemia. And the last and the most important thing is you should go for the obstetrical ultrasonography, which will tell the number of fetuses, because in case of twins or in case of triplets, there can be more chances of nausea and vomiting. And it also tells the location of pregnancy, whether the pregnancy is intrauterine or extrauterine. And the most important thing is it can rule out molar pregnancy also, which can also trigger more and more nausea and vomiting. So these are the guidelines which are recommended by FOGSI, and I hope it will help.